Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. Grim milestones this week in San Diego's fight against the COVID-19 pandemic. On Thursday, the total number of deaths in San Diego County topped 2,000 with more than 200,000 total cases. And at the national level, we're approaching 400,000 deaths. It's only been 1 month since we reached 300,000. As Taryn Mento reports, this is all happening as local health workers try to speed up vaccinations.
This is the immunization card.
The paper is proof Dalia Mohammed was one of the first in line at the county's new vaccination super site. Thousands of healthcare workers and long-term care facility employees are expected to come through the Petco Park lot daily.
So this is my sticker.
Community health workers like Mohammed bridge COVID-19 information gaps between government officials and hard-to-reach populations. She translates public health messaging for the Kurdish community through a county partnership with the nonprofit License to Freedom.
When you're sick, what do you do? How do you quarantine? How do you make a doctor's appointment? Those are very simple things sometimes that we think are very easy, but people in our community, they can't read that in English. They don't know what that's saying.
License to Freedom is one of 11 groups working together to reach communities in 20 languages. Mohammed says that includes debunking vaccine myths some people may be spreading online.
There are people who have been getting misinformation on Facebook, on Instagram about what the vaccine can do, and this is what they're reposting and they're spreading.
She's sharing her own experience to combat misinformation and encourage people to get the vaccine when it's their turn.
And it is up to us to put it on our social media, go out in the community, talk about it, call people, send text messages, have Zoom meetings, and have the entire community sometimes come together in a Zoom class.
The rest of the License to Freedom's counselors and community health workers are due to get their first shot this week. Once they have immunity and the vaccine is more widely available, they'll knock on doors to get others in line for their doses. Taryn Mento, KPBS News.
If you want to know just how much progress we're making on vaccinations, KPBS has you covered. We have launched a vaccination dashboard at kpbs.org. It shows the number of local vaccinations compared to the total population. You can also find a list of vaccination centers. To see the tracker, just go to the Tracking COVID-19 section at kpbs.org and then click on Vaccines. On Friday, the Trump administration announced another setback in the vaccine rollout. An administration official says new doses that were promised to states have already been distributed. That contradicts a statement from the Health and Human Services Secretary. Last week, Alex Azar said states would get the federal government's full stockpile rather than holding second doses in reserve. This change means many states will have to alter their vaccination schedules. One major San Diego health system is moving forward with vaccinations for patients 65 and older. But KPBS reporter Matt Hoffman says it'll be a bit longer before it is widespread.
After first vaccinating frontline healthcare workers, hospital systems like UC San Diego Health are now offering doses to some patients 65 and over. Officials there estimate they can offer as many as 500 vaccines per day, but for all local hospitals, that depends on
if we had any vaccine. Well, the only vaccine we've been given is for the healthcare providers.
Scripps Health CEO Chris Van Gorder says they're still finalizing vaccines for some frontline staff, but might soon have some left over for seniors.
We're hopeful that maybe next week we'll be able to do at least some of the 65 plus patients. We're now trying to calculate how much vaccine we'd have for that.
Van Gorder says Scripps is used to doing large-scale vaccinations like flu shots, and they're ready to scale up.
If the government really wanted to speed up the process, just get us the vaccine. Give us the very loose guidelines is what we would recommend, and we will start putting a vaccine in a lot of patients. And we can categorize it by the sickest. We can do it by age. The challenging part is when we say you're just going to give it to grocery store workers or some other essential worker. We have no idea how to even identify those individuals, and so that's what slows, I think, the process down. So make it simple. Get us the vaccine.
Healthcare systems will communicate directly with patients 65 and over to make appointments once they get vaccines. Some of that will happen through online portals like myscripts.com, so make sure you're signed up for those with your provider. Van Gorder says people are very eager to get vaccinated.
My head of the foundation was offered $1 million for a vaccine. a donation of $1 million. And we said no, that when they qualified, we'd let those individuals know. So there's a lot of people that are very anxious to get the vaccine. I mean, let's face it, we have a lot of seniors that have been locked away in their homes for a very, very long time waiting for this day. So this is the population, we need to vaccinate.
Matt Hoffman, KPBS News.
Senior care facilities are seeing their highest number of cases yet. As Amita Sharma explains, getting vaccines into the arms of these vulnerable people has been spotty and slow.
Scripps physician Carl Steinberg says less than 20% of area long-term care places have received the vaccine, and he says about half of caregivers have thus far refused to take it. The situation is worse statewide. Lawyer Mike Dark of California Advocates for Nursing Home Reform says only a small fraction of people at senior care facilities projected to have received the vaccine by now have actually gotten the shots.
We are getting calls every day from residents in long-term care and from their families saying, where is it? We know the vaccines exist. We know they've been set aside for us. We've not even heard from our facilities on what the plan is on actually getting them to us.
Sources say part of the problem is the federal government has left the vaccination process to CVS and Walgreens, which are not well equipped to handle such a large and complex undertaking. Meanwhile, Patricia Will, Chief Executive Officer of Belmont Village Senior Living, is using the extra time to educate residents.
We launched a really multifaceted information campaign involving experts, doing webinars for family members.
She says most of her residents are choosing to get the vaccine. Amita Sharma, KPBS News.
CVS said in a statement it's experienced in COVID-19 testing at senior care facilities and also dispenses thousands of flu vaccines in these communities each year. More than 2 million people have died from the virus worldwide, with more than 32,000 here in California. The pandemic has ravaged communities of color. Sarah Seidner talked with families who are begging people to do their part.
Quiero estar dormido que despierto de tanto que me duele que no esté.
Mariachi music slices through the silence. The melody is meant to soothe the family's sorrow, the cruelness of COVID-19 on display. This is a funeral in a parking lot.
My mother was a very strong woman, and she fought to the very last breath.
Juliana Jimenez Sesma says these are the last words they exchanged.
I told her, Mom, do not be afraid, for the Lord is with us. I love you and may God bless you. Keep strong for me, Mom. And all she answered me was, yes, mija. Yes, mija, with that voice, with fear.
Sesma lived with and cared for her mom, who had a lung condition. Her stepdad had asthma and diabetes. Her brother lives right next door with his young family.
How many people ended up getting it? Did everyone get it?
All of us.
Her stepfather and then mother ended up here, Martin Luther King Jr. Community Hospital. They fought to live just like those filling all the ICU beds now, but they died within 11 days of each other. Dr. Jason Prosso treated both Sesma's parents.
I just wanted to know that we here tried our hardest, and we're really sorry that things went the way that they did.
The terrible scenario is not unusual, as COVID ensnares those who live in multi-generational families and are part of the essential workforce.
We have had the misfortune of seeing this disease run through families and all too frequently take multiple members of a single family.
The state-of-the-art hospital is an oasis of care in the healthcare desert of South Los Angeles. It is no wonder the heavily Black and Latino neighborhood is suffering disproportionately. The inequities in healthcare invites death.
His blood sugar dropped below 40.
Diabetes is 3 times more prevalent here than in the rest of California. Diabetes mortality is 72% higher. The life expectancy is 10 years shorter here than in the rest of the state. And all of that is related to this being an under-resourced and underserved community.
That was before coronavirus arrived.
We're running well over 100% capacity.
The 131-bed facility is suddenly treating more than 200 patients. 60% of them are COVID patients. They've made space everywhere. Tents outside, inside hallways, the prayer room, a former gift shop. The battle to save a life, physically and mentally exhausting. But on this day, a surprise reminder of why they fight.
There she goes. There she goes. Oh, let me see. You got dance moves? Oh, yeah. Oh, yeah.
74-year-old Elaine Stevens returns to thank her doctor and nurses. She spent more than 40 days in this ICU before walking out alive.
I made it. A lot of days I didn't want to make it, but I did it.
As she celebrated a second chance at life, the ceremony for death was still playing out in a parking lot for the Sesma family.
Don't let this be you. If you truly love your loved ones, don't let this be you. Continue to, take all the cautious, take extra precautions, exaggerate if you have to.
Sarah Seidner, CNN, South Los Angeles.
And Imperial County is another place where a large community of color is enduring the brunt of the pandemic. iNewsSource investigative reporter Jennifer Bowman has an update on vaccination efforts there.
Imperial County officials say they are doing everything possible to get more vaccines, but they acknowledge the roughly 6,000 doses they have on hand won't cover all those eligible for the shots. So far, only the highest risk workers in healthcare have received a COVID-19 vaccination. Most of them work at the county's 2 hospitals, both of which saw a sharp rise in patients over the fall. Here's Jeanette Angelo, the county's public health director, at a news conference last week.
But because there's not enough vaccine right now, we have to distribute in an equitable way so that everybody who's doing that frontline work can get at least their highest risk vaccinated.
The county expects more vaccine doses this week, but also expects the limited availability to continue as the vaccination program progresses. As of Thursday, 460 residents have died from COVID-19. For KPBS, I'm iNewsSource investigative reporter Jennifer Bowman.
The U.S.-Mexico border will remain closed to all non-essential travel for at least another month. Government officials announced this week that current restrictions will last through February 21st. The closure is evaluated every month based on COVID-19 conditions. The San Ysidro Chamber of Commerce says businesses have been deeply affected by the closure. It says 125 out of about 800 businesses have been forced to close permanently. Sobering, but hopeful. That was the theme of Todd Gloria's first State of the City address. KPBS Metro reporter Andrew Bowen recaps the new mayor's message to San Diego.
Honestly, the state of our city is fragile right now, but I have faith that it won't be for much longer.
There's no sugarcoating the dire situation many San Diegans are facing under the COVID-19 pandemic. But the mayor made a few policy announcements, including a pledge to incorporate housing into new or redeveloped city building projects.
This could mean building apartments on top of new libraries and fire stations. And I will take a thoughtful approach to make sure that our transit system and our infrastructure can support these new units.
But absent a big influx of federal infrastructure dollars, it's unlikely the city will be building a lot of new libraries and fire stations. In the next few months, Gloria faces the challenge of closing a budget deficit he says exceeds $150 million. In the meantime, Gloria says for those still struggling financially,
next month, we will bring a proposal to the City Council that will extend our current eviction moratorium to keep families in their homes, help folks pay back their rent, and stop small businesses from being evicted.
Previous city council votes suggested waning support for the eviction moratorium, but the political landscape is in Gloria's favor, with 5 new council members and an unprecedented 8-1 Democratic majority. Andrew Bowen, KPBS News.
More financial help is coming to San Diego's Black, Latino, and Asian communities. Those communities have suffered a disproportionate impact during the pandemic. KPBS reporter Max Rivlin-Nadler has the story.
The money comes from the foundation's COVID-19 Response Fund, which has so far raised $64 million to support San Diegans during the pandemic. The foundation has already delivered $54 million in grants.
The pandemic has not affected all of us evenly. Under-resourced communities in San Diego County have been disproportionately afflicted by COVID-19. With the recent surge in coronavirus cases and hospitalizations in our county, the needs of San Diegans are continuing to grow.
The $300,000 will be distributed evenly between the three groups: the San Diego Black Chamber of Commerce, the Local Initiative Support Corporation San Diego, and the Asian Business Association of San Diego. The leaders of the chosen organizations don't feel as if the money will in any way dull the disproportionate impact the pandemic has had on minority communities, but will help keep some of these businesses that serve those communities afloat.
Most impacted are Black restaurant owners, hair salons, barbershop, neighborhood stores, childcare, and nonprofits that serve the Black community. So the challenge today is that it's the same challenge that it's been for decades. Many underrepresented businesses are challenged by cash flow on a good day, and over the last 10 months, it's been almost non-existent.
The organizations will be in charge of distributing the grants to small businesses and groups in their own communities. Applications for these grants are opening at the same time that a new round of applications for small business assistance from the county is reaching its deadline, meaning that businesses and groups can have multiple opportunities in the next few weeks to secure money to help them through the latest round of public health closures. Max Adler, KPBS News.
The San Diego Zoo and Safari Park has been forced to open and close during the pandemic. Now the virus is affecting some of its iconic animals. KPBS environment reporter has more on cases of COVID-19 among the zoo's gorillas.
The COVID-19 pandemic has touched a troop of 8 gorillas that live at the Safari Park north of San Diego. Keepers noticed several of the animals were showing signs of a sickness, so they tested fecal samples.
As you can imagine, there's a little bit of a challenge with that in that you're trying to match up the sample with the appropriate member of our troop. And that was sent out, and we got a tentative positive on Friday.
Peterson says the gorillas likely got the illness from an asymptomatic keeper. The zoo was requiring masks and gloves when interacting with the primates, but precautions will be stepped up. Keepers will keep a close eye on the gorillas to make sure the symptoms don't become severe.
We allow them to tell us what's happening through behavior and through what we see, and then we will intervene if needed based on the symptoms that show themselves. Fortunately, the symptoms that we're seeing are what we would consider mild. We're hearing a little bit of coughing, a bit of a runny nose.
This is the first known case of human-to-gorilla transmission in the United States, but there have been other cases of human-to-animal transmission, especially to big cats in New York and Kentucky, both of those in zoos. Eric Anderson, KPBS News.
It's a side effect of people spending more time at home. More trash at the Miramar landfill. KPBS reporter John Carroll tells us how the numbers are up during the pandemic and what we can all do to help.
The Miramar landfill, the end of the line for San Diego's trash, and these days there's more of it.
We noticed the increase in residential refuse and recycling from city residents actually in March.
March 2019, the unofficial beginning of the COVID-19 pandemic. Mid-month, Governor Newsom issued a stay-at-home order. More trash and recyclables started pouring into Miramar.
Our tons were up about 2,000 tons the month of March. It was almost immediate.
But why? Did people all of a sudden start using and then throwing away more stuff? Yes, but Matt Cleary says it's because many of us are at home a lot more than in pre-pandemic times.
People are working at home. Students are learning from home. We attribute the increase in tonnage to just that.
And that brings us to what folks in Cleary's business call the waste stream, and a further explanation of the increase in what the city is collecting. For franchise haulers, companies like Edco and Republic that collect business and commercial trash, it's just the opposite.
I think the franchise haulers are seeing a decrease in commercial tons.
But Cleary says the commercial haulers are seeing an increase in residential waste as well, and all their trash ends up in Miramar, too. So with all that extra trash going into the landfill day in and day out, is there cause for concern? Is the landfill going to fill up in the near future? Not quite.
Eventually, there will be a hard stop. However, that is not within the next 3 or 4 years. And the city is always looking at options to extend the life of the landfill.
For now, Cleary says we can all help in extending the life of the landfill. Think about buying things with as little packaging as possible. Beyond that, make sure you're recycling everything you can.
Ensuring that the proper materials are being recycled so that they're not going into the landfill, I think that would be extremely beneficial to increasing the life of the Miramar landfill.
The Miramar landfill opened in 1959. The date it will close is partly up to all of us, what we buy and how we dispose of it. John Carroll, KPBS News.
And there's been no shortage of the creative ways people are trying to help hospital workers and local businesses. Jacob Ayer met a woman in North County who is doing her part online.
Cindy Wood is an adjunct professor at multiple higher education institutions in San Diego County and a founding member of the North County Justice Allies, whose group mission is to offer support and protection to underrepresented and marginalized groups. Recently, her efforts have been focused on supporting local restaurants hurt by the pandemic, delivering food from those eateries to hospitals in San Diego.
They need to be something that can be eaten with no more than a napkin, maybe a fork at most. It needs to be something that can be eaten quickly because these workers only get a few minutes break.
The effort began on December 12th when Wood shared an online post for an addiction awareness initiative at Pandora's Pizza, which delivered food for local ICU staff. Since then, Venmo donations to Wood's account have soared, and the effort has raised just under $12,000. With all the funding, Wood has been able to continue supporting North County restaurants like Chick's Natural on a daily basis.
You can't just give up. A lot of people are giving up. I mean, I think there is hope. You know, we're a family-run business, so everybody pitched in. My daughter helps, my son helps, so that makes a big difference.
The second part of the plan is delivering the food to hospital staff, with the majority of donations going towards Scripps Memorial Hospital and Sanitas.
I'm inspired to keep this going. Members of the community are inspired to continue to help in ways that work. You know, mutual aid is something that a lot of people are talking about right now. The Justice Allies are working on a mutual aid fund, and yeah, I do see this continuing to grow. I don't know how yet.
Wood says her efforts inspired acquaintances throughout the county to begin similar initiatives. Better yet, she expects to continue delivering food from local North County restaurants to hospital staff for the foreseeable future. Jacob Ayer, KPBS News.
The pandemic has not left anyone untouched, particularly children in their formative years. I recently spoke to a 6th grader at Francis Parker School, Arden Paula. An actor and author, he is no ordinary 11-year-old. His latest book celebrates the uniqueness of cultures around the world. Here is our interview. Arden, welcome to the program.
Thank you for having me.
So while most kids spend their summer breaks not wanting to do any work, you wrote a 24-page children's book based on your vacations to Turkey, China, and most recently to Mexico. Tell us about the adventures of Noah's flying car.
During COVID, you can't really get out to go to vacation, and so I just wanted to bring the country to you in a book. And I don't want it to be a history book where it's just facts. I want to bring in characters too to make it a little more fun. At least that's my goal.
And in your books, you explore things like the food and the history of the countries that you visit. And those are all from the eyes of children who are in this flying car. What are some of the adventures that your characters go on?
My newest book, they go to oceans, they see whales, they go to butterfly reserves, they eat tacos and burritos.
We have a good timing because it's migration season, Mrs. Melissa said. Reason whales migrate is to have their babies in the warm Mexican lagoons. They swim 6,000 miles to get here, Caden said. After a few minutes in the flying car, we landed in Todos Santos.
All these places I've been to and I experienced, and this is all from my standpoint of what I remember from it.
Arden, can you tell us what the main message you're hoping that readers are going to receive from these books?
I'm just so, I want to like explain diversity too, because I'm different. I'm Turkish American, and basically it's like okay to be different, and it's fine. And basically, yeah, I just want to explain diversity.
This particular book, it raises money for the San Diego COVID-19 Community Response Fund. Why did you decide to donate to this cause?
I just want to, these are very hard times, so I just want to make sure everyone's okay. And I just want to help San Diego a little bit more by donating all the proceeds to this book to the COVID response funds.
You recently were awarded the Best Child Actor by Los Angeles Film Awards. Tell us about this great honor.
So during the summer, I was selected to be in this movie called Taz. I worked really hard for that, and I just enjoyed having the feeling that like about getting an award. It felt so good. I had such fun meeting the crew and the cast. It was awesome.
Arden, Paula, thank you so much. Really appreciate your time.
Thank you for having me.
And that's all for this special edition of KPBS News. I'm Maya Trabulsi, and for all of us here at KPBS, thank you for joining us and stay safe.